Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video about the most effective approach that I've found for treating Epstein-Barr virus, also known as EBV. Someone had posted a question on one of my earlier videos that was about EBV. I think it was the video I posted about the research that came out linking Epstein-Barr virus infection to developing MS, and they were asking what are the best antivirals that I use. Very good question. And just before I jump into addressing that or answering that question, I just want to let everybody know that I am putting together, or I have put together, and I'm about to launch a online course that's all about basically navigating the waters of chronic illness. I posted about this on Facebook, and I just haven't yet put together an Instagram or a YouTube post or video yet. So this is, I guess, the first time I'm mentioning it on those platforms. If that's where you watch my videos. But yeah, basically I have this multiple module course. I'm going to be disseminating more information about it coming up pretty soon. But it's basically covering all of the major topics that are really important, in my experience, to know about to help folks to recover from complex chronic illness. So covering topics like chronic infections, like Borrelia and co-infections, heavy metals, viruses like Epstein-Barr virus, histamine-related issues, mitochondrial dysfunction, detoxification pathway issues, and just a whole lot of other topics. So it's essentially a thorough yet easy to digest course to help folks make some sense out of the complexity that is complex chronic illness. And part of the course also includes handouts that I've put together that kind of these cheat sheets, as I'm calling them, that basically summarize salient information about testing and treatments on all these major topics, so that folks who participate in the course can get access to those and then bring those or send those to their healthcare providers, so that gives the healthcare providers some better sense of how to help manage their case. So, for example, I have patients who have come in saying, I'm working with a doc and they're like a SIBO specialist, but they just don't know much of anything about mold and Lyme and co-infections. And so like I'm being partially treated, but not fully treated. So these are some information that will be helpful for those providers, hopefully, to get the right testing or treatment irons in the fire. So anyways, the reason I wanted to bring this up is for folks who have heard about my mentioning of this course earlier. I just wanted to let everybody know that I have finally decided on the dates for the course. So the course dates are going to be, so it's going to be 4 weekends. I'm going to be covering 2 modules per weekend. The sessions are going to be, I'm planning for an hour, but should be about an hour, but I'm going to book, or earmark rather, about an hour and a half, because there's going to be opportunity for Q&A after each session, and just in case folks have a lot of questions, I'll be available. So all the sessions are going to be on Saturdays, starting at 1 p.m. Atlantic time, which is 12 p.m. Eastern time, and 9 a.m. Pacific time. And they'll be running for probably an hour, but maybe up to an hour and a half. And the first session will be on Saturday, May 28th. And then the next one will be the next 2 Saturdays, so May 4th and May 11th, and skipping May 18th because I have a jiu-jitsu tournament and I don't want to miss that because it's one of my passions. And then the last one will be on June 25th. So that will be the 4-weekend extravaganza. So I'm still just getting some of my registration material figured out, the landing page where folks can go to get more information about this. So I'll post a subsequent video about this and where you can go to register and sign up if you're interested in participating in the course. And yeah, so I just wanted to get those dates out there and let folks know, so you can save the date if you're planning to attend. All the sessions will be recorded. They'll be available to access after the live event. So you can't attend live on those dates, no problem. If you want to still access the material, it'll be available. And that's all I wanted to say about that. So moving to the Epstein-Barr virus topic at hand. So when it comes to treating Epstein-Barr virus, and of course bearing in mind that this is all for informational purposes and nothing should be construed as medical advice that I'm about to say, just please talk to your healthcare provider before making any health decisions for yourself. Please and thank you. So when it comes to Epstein-Barr virus, talking about the best antivirals is important because they can be certainly a very key part of the treatment protocol, but it is always important to remember that Epstein-Barr virus, when folks do test positive for Epstein-Barr virus, or they get mono and they just don't recover from it, oftentimes there are other underlying factors that are afoot too. So the number of patients that I've had where they test positive for Epstein-Barr virus, put them on antiviral herbs or other treatments, and they get all the way better from that, it's pretty rare. Improve, yeah, for sure. That's a semi-common thing that happens. Get all the way better from that, not too often. To really help folks to recover from Epstein-Barr virus, in my experience at least, we oftentimes need to rehabilitate the mitochondrial function. In many of those cases, there's an underlying mold issue as well, or maybe a heavy metal issue. Maybe there's some other type of chronic infection going on. Sometimes there's an amygdala dysfunction component. Sometimes there's nutrient deficiencies or digestive issues that are underlying things. So the question that I'm always approaching those cases with is, why is the EBV overexpressing in the first place? Why isn't the immune system clobbering it as it was designed to do and just getting it, put into latency or put into dormancy? So we always have to think about those other factors. But in terms of the direct antivirals that I found to be the most effective, there's this wonderful book written by Stephen Buhner. He's an herbalist. I've talked about him on a number of other videos. He's second to none in terms of providing information for clinicians and the lay public about just the best antiviral herbs, anti-Borrelia herbs, anti-co-infection herbs. He's written books on all these topics. So he has this great book. It's called Herbal Antivirals. Gets into this in a lot of detail. And of course, I can't talk about dosing or anything like that because that could be construed as medical advice. But Stephen Buhner does talk about those things in his books. And so it's a great book, pretty inexpensive. I think it's maybe $20 or $30 to buy that, and it's just a fantastic book. So the herbs that he talks about in there, lo and behold, he really knows what he's talking about, because those are, in my experience, the strongest antiviral herbs. The herbs that I used to use for antiviral treatment, replace them with the Buhner inspired herbs, and just night and day difference in terms of how well they work. So my favorite herbs, favorite antiviral herbs are Chinese skullcap, one called Isatis, one called Hutunia, one called Boneset. Those are some of my top favorites. Lomatium's a good one too. Just some people get a rash from that and it's off-putting, so we don't use that one quite as often. And I mean, there are others too, like wild indigo can be helpful. Antigraphis, it's just really bitter. But the first ones that I mentioned, those are kind of my core ones that I work with. We usually put those in a combination formula and oftentimes use those. I mean, licorice is good antiviral, but it can jack up blood pressure, so we have to be careful with that, although it tastes nice, so that's nice. Most tinctures don't taste all that great. And not that they have to be in a tincture form, but that's the way we usually use them. Another useful adjunct when it comes to Epstein-Barr virus treatment, in my experience, is using intravenous ozone therapy. Unfortunately, not everybody can access intravenous ozone therapy, either due to distance or cost or whatnot, but if patients can access it, I found it to be really helpful. And then intravenous photobiomodulation, also known as intravenous laser therapy, especially when it's combined with photosensitizers, so these oral agents that are taken to help enhance the effect of the lasers. That's, in my experience, been the strongest antimicrobial treatment to date. So that's something that we can use if we really seem to need to clobber those viruses more aggressively. As I alluded to earlier, though, that's not always the winning strategy. So more often than not, we have a patient on the herbs, maybe they're doing some ozone, and we're like, okay, they're better, but kind of hit a plateau. When we blast them with a laser, sometimes it does provide or produce an additional benefit. Oftentimes, that's not the missing piece of the puzzle. It's usually that we haven't been supporting their mitochondria. We haven't been addressing some of the other underlying issues. Now, the approach I take, I always advocate for supporting all of those areas, but sometimes patients say like, no, I just want to work on killing this virus first. I don't want to support my mitochondria yet or whatnot, and that's fine. But in those cases, oftentimes we'll hit a plateau if we're just using an antiviral approach. So I hope that answered the question, and if anybody has any questions or comments, please leave them in the section below. And again, I will post, if you're on Facebook, I'll post information about my course on this medium in the not too distant future, within the next several days, hopefully. If you're watching me on Instagram, I'll post it in my link tree. And if you're watching me on YouTube, I don't really know how to post links to things on YouTube. So I guess I'll post it, that's what I'll do. I'll post it in the section below the video. I'll post it in the section below, as people do. I don't really post stuff like that on YouTube often, but I'll learn. So anyways, hopefully this was helpful, and I will leave it there.